As per usual, it's my task to share with you the Health Emergency Operating Center Situation Report for today, May 19, 2021. Ladies and gentlemen, the Federation of St Kitts and Nevis has reported 46 confirmed cases. So we now have a total of 46 confirmed cases of COVID-19. 45 of these cases have fully recovered, and at present, we have one active case. Let me just share some information. The Federation just confirmed its latest case of COVID-19. Case 46 is a national who does not have a travel history. The individual works in the hotel industry. The case is stable and is in isolation as we speak. The Health Emergency Operating Committee had an emergency meeting this afternoon at 2 p.m. and the public health team has been deployed to conduct contact tracing. Our aim is to identify and engage all the contacts of this case. All the contacts will be tested and placed into quarantine immediately. I want to assure you, the public, that all steps are being taken to reduce the risk of exposure to the SARS-CoV-2 virus. Ladies and gentlemen, I would like to use this opportunity to underscore the importance of one, the vaccine, the COVID-19 vaccine that we are administering at this time, and the COVID-19 prevention and control measures, the importance of hand sanitation, the importance of wearing your face mask when in the public space, the importance of physical distancing, making sure that you maintain a 6 feet distance when in the public space, and social distancing, avoiding crowds at this time. These measures are very, very important at this time. The COVID-19 pandemic continues with over 163.3 million confirmed cases globally and over 3.38 million deaths reported. Now, most countries globally have been rolling out their COVID-19 vaccine programs, and to date, over 1.41 billion vaccine doses have been administered globally. In the United States of America, over 32.9 million confirmed cases and over 587,000 deaths have been reported. Now, this slide just provides you an overview of the global status regarding COVID-19 vaccination, with Seychelles and Israel out at the front with a significant proportion of those populations being fully vaccinated. Seychelles 63%, Israel 56%. The United States 38% of that population fully vaccinated, and in terms of the United Kingdom 31%. The virus continues in the Caribbean region. It has impacted over 173,000 persons within the CARICOM member states. The virus continues to impact the Organization of Eastern Caribbean States, where you are seeing a gradual rise or increase in the number of confirmed cases, being over 12,300, and the number of deaths. Here in St Kitts and Nevis, we continue with our vaccination program. Now, as at yesterday, the island, the Federation, we would have administered 18,695 COVID-19 doses, with over 14,028 in St Kitts. In Nevis, 4,667. Ladies and gentlemen, we have covered, in terms of administration of the first dose, we've covered 44.2% of the target population with the first dose, and we would have covered over 12.4% of the target population with the second dose. Now, the figures for today just came in, and the next speaker, Dr. Cameron Wilkinson, will provide you the latest figures as of this afternoon. In St Kitts and Nevis, our surveillance system is quite robust. We continue testing persons who present with signs and COVID-like signs and symptoms, with over 14,000 persons being tested to date, and a positivity rate of about 0.3%. To date, we now have a total of 46 positive cases. Next slide. Again, within the Ministry of Health, our strategy is twofold. Our aim is to reach the herd immunity and vaccinate the adults in our population, which comprise about 70% of our population, and we continue to minimize the risk of exposure to the SARS-CoV-2 virus. Again, I just want to provide some information about the AstraZeneca Oxford vaccine. This is the vaccine that we have available to us. There's a saying that goes, the best COVID-19 vaccine is the one that we have. It's the one that we have access to. Here in the Federation, we have access to the AstraZeneca Oxford vaccine. If you are fully vaccinated, it affords you an 83% risk reduction in terms of contracting the virus. We are utilizing, it's a vaccine that has a 2-dose regimen, and it can be given anywhere between 1 month to, the 2 doses can be given anywhere between 1 month to 12 weeks apart, and it must be administered to persons 18 years and over. At present, this vaccine is being offered to persons, to women or ladies who are breastfeeding or lactating. However, at this time, it's not being offered to pregnant women. Ladies and gentlemen, this vaccine can be given to individuals or persons living with HIV. It can be administered to individuals who are immunocompromised. For example, those individuals who are diabetics and those who are on steroids for other medical conditions. This vaccine can be administered to persons with autoimmune conditions, and it also can be administered to persons who have been diagnosed with COVID-19. So in other words, persons who've had a COVID-19 can be vaccinated. However, the vaccine can be administered anywhere between 2 months to 6 months after the individual would have recovered from COVID-19. This vaccine, it's WHO approved, it's safe and effective, it works well in older adults, and it has a very wide global reach. In other words, it's being utilized in over 148 countries worldwide, and it provides significant protection against the emerging variants of concern. Now, persons who have received this vaccine, they only complain of mild symptoms, including tenderness at the injection site, chills or feeling cold, mild fever relieved by over-the-counter fever medication. But ladies and gentlemen, the major point I want to make here is that those of us who would have taken the second dose of this vaccine, we hardly experienced anything. In other words, the persons who have received the second dose of the vaccine hardly complained of any signs or symptoms. Probably just mild pain at the injection site, but no, I haven't heard anyone complain of chills or fever. So the side effect profile in terms of this vaccine remains pretty good. Next slide. Just wanted to highlight that there is a travel advisory regarding travelers coming into the Federation from Brazil, the United Kingdom, South Africa, and India. Now, ladies and gentlemen, at present, our public health team, we are investigating or conducting contact tracing with respect to the last case 46, which we just identified. And we do not know the true status. However, what I want to underscore is the importance of the COVID-19 prevention and control measures. Wearing your face mask in public spaces, hand sanitization, social distancing, avoiding crowds, and physical distancing. And most importantly, be empowering yourself with the latest information about the COVID-19 vaccine. And we want to encourage you to make the wise decision of accepting the vaccine, because it provides you protection against the virus.